Right, let's bring you this discussion now. The Johannesburg High Court has ruled that pregnant women, in fact pregnant and lactating women, and children under the age of 6 have a right to free health care regardless of their nationality and their documentation status. Now, the Health Department says it is still studying the judgment, but several organizations brought this legal challenge, saying that everyone should have access to health care. For more on this, we're joined this morning by Claire Waterhouse, who is the head of MSF Southern Africa, its operational support unit. Claire, great to see you. Thanks very much indeed for coming on. Such an incredibly important story. Thank you. We're saying that there was a number of organizations that brought this legal challenge. Was there any particular case or cases that led this story to go to court?
Yeah, so the case was actually brought by Section 27, and then several other organizations, including Doctors Without Borders, acted in support by providing affidavits. So Section 27 did have a specific case. They actually had 3 affected individuals who brought the case to them, and then they took it to court, and several others of us provided support through other things that we had witnessed by providing affidavits.
And what were some of the things, I suppose you'll speak on behalf of Doctors Without Borders, what were some of the things, some of the treatments that you witnessed, migrants seeking health care in South Africa?
So essentially what we had started witnessing was that in 2020, a new memo came out from the Gauteng Department of Health that was unclear in how migrants, especially migrant women, pregnant women, lactating women, and children under the age of 6 should be treated. And so what we were seeing was that this particularly vulnerable group of people were being charged at hospitals and being charged at private fees. So not means-based testing, but private fees, which were exorbitant. And many people could not afford those. So then what we saw was that people were not accessing care, were not able to access care at a very, very vulnerable part in their life. Pregnant women who could not access antenatal care, who were afraid to go to hospital for C-sections, needed C-sections, etc. Children who were getting very sick but whose parents couldn't take them to hospitals because of that. So we started seeing that it had a really negative impact on healthcare because the amounts being charged were extremely expensive, and the population itself, they're extremely vulnerable anyway, were not able to afford this. And how that ended then essentially in several cases that we are aware of at least, was that the conditions would deteriorate until it was an emergency condition. And then of course South Africa does provide free emergency care to everyone, but that is more expensive. By the time that people get to an emergency level of care, they cost much more to the health system. So actually, in the end, it was a decision that did not make sense for South Africa financially, let alone in terms of compassion.
Yeah, absolutely. Many migrant women also talking about the fact that they're expected to travel, in some cases, to other provinces to try and renew their documents in Pretoria, which is also a cost implication for them. It's just something that's completely unaffordable for them to try and access that health care.
Yeah, there are a lot of hidden costs in being a migrant in South Africa and trying to access healthcare. Obviously, we've seen a lot of various things happening over the last few months, and this latest issue, which was what Section 27 took the case about, was just one of the bigger things that we all started to notice because, like I said, when you're pregnant, when you're lactating with a very young baby, or when you're under the age of 6, you are particularly vulnerable and you do have very specific healthcare needs.
So the Health Department says it is still studying the judgment, Claire. Are you and the other organizations preparing yourselves for possibly an appeal?
We don't rule anything out at this stage, but of course we'll be monitoring what happens. The judgment has been quite clear in deadlines and specific things that it wants the department to achieve, and we'll continue to monitor and see that those things are implemented. And of course, we are always, as the government knows, willing to work with them to help achieve these things.
So Claire, a number of laws in South Africa now need to change, surely, right, in response to this decision by the High Court? Because in that circular that you mention, the circular does confirm that refugees and asylum seekers with or without permits can access basic health care in South Africa. So it's free at a particular point, but it can be charged thereafter. This is just one of the things that now needs to change in law.
So actually, no, nothing needs to change in law. What we asked was the court to, or what Section 27 asked, was for the court to reaffirm what is already in the National Health Act. So the National Health Act already says that all pregnant women, all lactating women, and all children under the age of 6, irrespective of their nationality or status or documentation status, is allowed to access free health care at public facilities. So all we asked was that that be reaffirmed, because what we had seen was that this memo that came out in 2020 from the Gauteng Department of Health had caused confusion around that and had caused some hospitals to start to charge.
Yeah, absolutely. So let me ask you this, Claire, because in some of the reportage around this High Court decision, it also sort of clarified that what the court said was that pregnant and lactating women and children under the age of 6 can access free health care if they're not in the country specifically seeking health care. Can you give us clarity on that?
I'm sorry, could you I didn't hear the question.
So it's the access to free healthcare if you're not in the country particularly seeking healthcare. So you've not traveled to South Africa for healthcare. Is that right?
So I don't think that there's any qualifications like that. I think that, that could be something that the government may wish to discuss, and that's to them to do so. But certainly I know that the National Health Act is very clear in that it says that this population, these pregnant women, lactating women and children under the age of 6, no matter what, are entitled to free healthcare in South Africa.
Okay, no matter what. So, Claire, children under the age of 6, I suppose that still leaves a gap, right, for 6-year-olds and older children?
Yeah, it does. Of course, anyone would want to see that all children can access the healthcare that they need. I think that's, any of us who see a child suffering would want to see children accessing healthcare. But there is specific vulnerabilities, and that's why this categorization exists. There are specific vulnerabilities for children under the age of 6, so that's why we've specifically asked about this segment of the population, and that's why that segment is also clearly defined in the National Health Act.
Yeah, that makes sense. Claire Waterhouse, let me thank you for your time this morning. The head of Doctors Without Borders Southern Africa Operational Support Unit, talking to us about this important decision in the High Court, actually just confirming what already exists in law, that all migrants, despite their documentation status, pregnant and lactating and children under the age of 6, can indeed access free health care in South Africa.